Hey guys, it's me. I'm back. I know it's been over a week, but I'm here. I gotta push myself to do this video this evening. It's evening where I'm at. In fact, it's no, you probably don't care. About 7:25 in Cali. Um, so I'm here with an update. Nothing has changed dramatically, but I'm just here to do my usual update and pretty much talk about what's been going on. So let's start with I guess my doctor's appointment with the neurologist, which was last week. I should have vlogged the last week, but I didn't. And I wasn't feeling it. I was weak and down, you know, I have these mood swings since the surgery and everything. So some days I'm good. Other days it's just like, you know. Um, so as I mentioned before in my other videos, I still have drainage tubes that are connected to me. One in my stomach and one in my back. I'll probably try to insert pictures in here so that you can see kind of what I'm working with. All right, so on to the appointment. So I talked to the neurologist, and basically he said one side will come out either at the end of this month or next month. So that will be the right side because I'm getting less drainage out of this side now. Left side, we still have a lot. Still a lot going on over there. So I'm looking at probably still having this for maybe another month or so. I'll say probably another month. So I probably won't get this one taken out until we're almost in February, maybe like March. Yeah. And it's still very uncomfortable trying to work around these tubes and stuff. Showering is such a huge challenge, you know. I'm gonna just be graphic. I have to like strap the bags to my legs and all this nonsense in order to shower. Most of the time, I'm gonna be honest, most of the time I just kind of do a wash up because the hassle of strapping the bags and all this kind of stuff, and you know, and not getting my my bandages and stuff wet because I only have a nurse currently coming out once a week to change the bandages and to kind of check vitals and things like that. When I do the bandages myself, I have my ex do it. It is a whole fucking mess. I mean, it lasts for a little while, but it start coming loose. I have to do retaping and retaping and retaping. I have so much tape on me that my back, just my back, my stomach is okay. It's not as bad. Is sticky from tape residue, you know. So I prefer it better when the nurses come do the changing of the bandages and stuff versus me or my ex doing it, you know, because it holds better. And I think it's the tape. The tape kind of sucks big time, but I mean, hey, whatever. So, yeah. So far that's what's going on. I have my post-op appointment on Thursday, this coming Thursday. No, yeah, this coming Thursday on the 20th. Yeah, at first I thought it was Monday. I had a huge brain fire. I thought it was Monday. And I looked, I was, oh shit, no, okay, it's Thursday. So I'm supposed to return to work on the 19th, which is the day before. That's not going to happen. It is not going to happen. I already talked to some other doctors. I'm like, hey, I need more time off. One, I'm still not very um not hugely mobile. I mean, I can walk and stuff like I mentioned before. Like today, I figured, okay, let me get out and try to walk around and build up, some strength, So I went out, my ex went out to walk the dog, and we did a little walk and stuff. And then all of a sudden, my legs started, I started feeling tired and stuff. And oh, that was just, I was proud of myself because I actually pushed myself to do the walk, because most of the time, like I said, I use my wheelchair when I go out because I don't want to have that very experience, when I'm out, or my leg gives out, or just whatever. So, excuse me. So, I'm trying to get away from having to depend on that wheelchair, just like with the walker. I came home with a walker and came home basically, well, not came home with the wheelchair, but the wheelchair was already here. Those are the things that I came pretty much when I was released from the hospital. Those are the things that was given to me. So I'm not using a walker, thank goodness, but I am still dependent on that damn wheelchair, and I don't want to depend on that wheelchair when I go out. I need to build up strength. I need to get myself going so that I can return back to work, if I can. So far things is just like I mentioned before, is when I try to do little house chores and stuff like that, my back hurts or whatever. I'm still dealing with pain. This side of the stomach, of my stomach, I still have discomfort, pain at times. And the neurologist said, well, it's probably, due to the tubes and whatnot. So he says, once it comes out, once it's taken out, you probably feel a whole lot better, or, whatever. I hope so. Gosh, I hope so. Because this is ridiculous. Like, right in here, you can actually feel the tube, kind of protruding right there and stuff. So, and then the itching. Oh my God, the itching around where the tube is just, ugh, you know. So yeah, it's been tough. It's been a process. Um, like I said, I didn't blog last week because I was just I was down, I was weak and just tired. At least that's how I felt. I felt tired, but I think it was more of my mood that was making me feel what I thought was tiredness. Um, like I've mentioned before in all my previous videos, is that I really didn't expect this to be my outcome from my surgery, hadn't this taken a left turn, I would probably be feeling uh good enough to return back to work, but that's not the case. And so that's very disappointing. Not to mention that I have no source of income, you know, um, from this, you know. Um, I'm trying for disability right now. We'll see how it goes. But from the job that I work at, yeah, it's a little complicated. It's complicated. So I'm not sure how this is going to turn out, or if I'll even be able to get disability. So I'll be pretty much around here with no income, if I can't get myself together enough to go back to work, you know. Um, it's just it's just a terrible thing. Um, I don't know. like I said, I haven't seen any other videos where, you know, uh, someone's had to go through this sort of thing. And I'm sorry if I'm doing a lot of pausing, but I'm just like, I'm in thought process as I'm going along, but every time I come in and I do these videos, it just makes me think so deeply about my situation. It's just like, how in the hell did I get here? You know, I was supposed to just have that fibroid and my large uterus taken out. And speaking of that, I have lost so much weight. At one point, um, I'll say the year before last, so 2020, I was weighing close to 170. So I went from 170 to, I just weighed myself yesterday, and I'm down to 126. 126. So that's huge. That is huge. There's, yeah, a dramatic change in my body. I went from having huge boobs to like not having any boobs at all now. And, having an ass and not having an ass at all. So that there has kind of affected me, emotionally, because I've had to just recently get rid of a lot of clothing, which isn't a bad thing. I'm not gonna say it's not a bad thing, because I was actually too overweight for my height and stuff. I was overweight, and I was wanting to lose weight, but not so drastically and not so much. But anyway, so I got rid of a lot of clothes and things and stuff that I can no longer wear because I'm so thin now. You know, I went from wearing a 11, 12, 13 to now I'm most likely a size 5, at the most a 7. So yeah. The one good thing that I can look at from this is that I'll be honestly ready for summer once I get myself together. You know, I get back on track, and yeah, I'm kind of looking forward to that. But again, it's still a drastic change that I'm still trying to adjust to. You know what I mean? Um, it's just so much. It's so much, from the dramatic weight loss to the surgery going bad. Um, to me, not being able to go back to work in the time frame that I was supposed to return back to work. It's a lot. It's a lot mentally, you know. And that's why, again, like I said, I didn't come in last week. I'm trying to be consistent and do an update vlog at least once a week, twice, depending on how I feel, but I just could not muscle up enough energy to do it last week. And, you know, I can't allow myself to keep being in those sort of spaces where I just, can't get myself together. You know, it's just something as simple as recording. That's it. And just talking about how things are going for me. It's just simple as that. It's not hard. It's not stressful or strenuous, but I just could not do it. I get up one day and I'm like, okay, today I'm going to record. And I'm like, ugh, I don't feel like doing it. I'll do it tomorrow. Tomorrow comes, again, the same thing. And I'm just like, I don't feel like doing it. My back hurts. My stomach hurts. And speaking of that, I've been going like pretty much back and forth to the hospital. Now, last week, I had so much pain. So much pain. I believe, what day was it? I believe it was a Thursday, so it was last Thursday. Yeah, it was last Thursday. Yeah, when I went to the ER. And so I went early in the morning. Mind you, I had to drive all the way to San Diego because that's, pretty much where I had my surgery. And I drove all the way out there. When I got there, there wasn't that many people there, um, waiting to be seen. So I'm noticing like it's a huge lobby. It's huge. So there's the huge part of the lobby on one side, and then there's a little smaller part on another side where people were sitting. And so I don't know if anybody knows this, um the basically the steps, protocol, whatever you want to call it. You go to when you go to the ER, and they want to know if you've you've been exposed to anyone who has COVID, blah 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 blah. You know, they want to, have you been vaccinated? All this nonsense. Anyway, so I'm like, no, and I definitely can't afford to be around nobody who has COVID. I'm still weak myself. I'm still trying to build up my immune system. I'm very weak. I've lost a lot of weight. I'm anemic again, because I'm so skinny and stuff. Before, when I was heavier, I didn't have this issue. Now that I'm all skinny and shit, like, now I'm anemic, and I'm cold all the time. And you see, I'm wearing a sweater and I have my blanket that I kind of keep with me all the time. Anyway, so, while we're sitting there and stuff, um, of course, they don't allow you to have visitors. Now, I'm in a wheelchair. And they're like, oh, well, my ex takes me in, and they're like, oh, well, you can bring her in, but once she's checked in, you have to go. So he's like, well, shit, I'm going to just go. I'm going to just be seeing myself. So I'm like, oh, boy. I'm like, here we go. So he told him, he's like, my back hurts. So, I want to see the doctor too, which he does, have back pain every now and then. But anyway, he wanted to be sure he just wanted to stay in with me. So I'm sitting there and I'm waiting. And I start to notice, like, okay, they got people on this one side and they got people on the other side, but the people on the other side, there's this one person that's coughing, constantly coughing. So I'm like, okay, I don't want to judge because I'm asthmatic and I cough quite a bit too when I have a flare up, which we'll get to that too. So I'm like, okay, well, I'm not going to judge, but it is a little strange that, that person is sitting way back over there at the other end. Then I noticed more people were coming in, and I guess the people that was sitting on the other end were people that were there to be seen, I guess, to be tested to see if they had COVID or, So, I'm sorry. To get a message. Anyway, so as I'm sitting there waiting to be seen, they see my ex. So I'm like, okay, I'm like, I'm going to be called pretty soon. It's not that many people here. I'm sitting. The pain is getting worse. And I'm thinking, what the? So my ex asked one of the nurses or, the checking people, he's like, how much longer is it going to be for her? Here comes, he's talking about, oh, it's going to be 3 hours. Three hours for who? Not me. We were here before all these other people. Because now you got to think, for the time that we've been sitting, more and more people have come in, right? So my ex already been seen. So I'm sitting here. I'm like, 3 hours. The fuck? No, you better. I'm not gonna make a scene. I'm in pain, and I don't have the energy. So I flat out told him, I got so frustrated. I got pissed off. And I told my ex, I says, well, my ex is white. Okay? I'm going to just put that on. My ex is white. And I was like, well, how did you get seen Before me, I'm in pain and stuff. I done told these people I got drainage tubes in me and stuff. And I got like um this one side, this right side, instead of it having urine or whatever that is draining, the shit was coming out slimy. It had a foul ass odor or whatever. You ain't gotta be rock. It's not rocket science. That was an infection. Okay, so I'm thinking, and I told them this. So it's just like, you got seen for back pain. I'm still sitting here, and not only that, these motherfuckers telling me that I'm gonna have to wait 3 hours. Who? Not me. You must mean some of these other people because I've been here, you know. So I was almost said, well, how did you get seen before me? Is it the skin color? They just gonna sit here and have me waiting for 3 hours, and we both came in together, and we're here for honestly for me, you know. So I'm in pain. I got the situation here, and they told me I gotta sit for 3 hours. Oh yeah, yeah. There I was. Yeah. Anyway, so the nurse comes back and he was like, "Oh, it'll be it. There's one person ahead of you, and then they'll call you." I was okay. Well, that sounds better because how the hell you gonna have me sitting here 3 hours? Okay, I'm back. I don't remember where I left off at, but I do remember we were talking about me being at the emergency room. Okay, so like I said, so I finally got called to the back to be seen and everything, and yeah, so they did urine tests, what else? X-ray. They had to give me a COVID test, of course. I'm not vaccinated, so whenever I go to ER, most of the time it's ER because they don't do it at urgent care. They don't make me do it at urgent care, but the emergency room, they always test me for COVID. Anyway, so my asthma was flaring up too, so that was another reason why I needed to have the test done. My asthma was flaring up. I had pain on the side, the issue, you know. I was just all jacked up last week. Anyway, so uh comes back. I had a bladder infection. They gave me antibiotics for that. They gave me some pain medication. And let's see, what else? Oh, and breathing treatment and stuff. And then they gave me IV antibiotics, and OMG, I swear every time I go to the damn hospital, these people, when it comes to my IV and stuff, because I'm real sensitive when it comes to medications and stuff like that. So, um, I was just like, Lord. So he gave me the antibiotics through an IV. So I'm like, okay, you know, I like them to go slow because if they don't, if they just, you know, shoot me up real fast and shit, I sometimes, depending on the medication, whatever, I have a reaction. You know, sometimes I'll feel pain or I'll get, you know, get sick. So that's what happened. So he put the antibiotics through my IV and then, of course, flushed it or whatever. Right after that, I threw up. And so I was just like, oh my God. And they was just about to discharge me too. So since and the doctor had just walked out, and when I throw up, I like literally throw up violently. So I just you know, it's ridiculous. But anyway, so the doctor heard me, so I had to stay another fucking half hour just so they could monitor me and make sure that I was okay, you know, from the antibiotics and stuff. And I'm like, I'm just fine. I'm fine. I think it was just, you know, because, you know, it was too fast in my IV and whatever. So I'm just like, the doctor says you have to stay, you know, so we could make sure you're okay. Okay, fine, whatever. So yeah, so I've been taking the antibiotics, so I have to take the shit for like 10 days and stuff. So I'm still on it right now. I have to take what? one tablet 2 times a day. So once in the morning and then in the evening. So everything, the infection is, significantly cleared up. There's no more odor, and it's not, when I drain this the right side, it's not coming out slimy and gross. Anyway, so yeah, so like I said, there was so much going on with me last week that I just could not pull myself together to come in and vlog, Um, I felt pretty good today. So this week it's been a little rough for me as well. And to top it off, moving, and that's kind of a little bit of a stressor because I'm really not in a condition to be doing packing and moving shit around and stuff like that. So it's kind of stressing me out a bit, like how in the hell am I going to, manage this shit. But I guess we'll see. I guess we'll see how things turn out, you know. But yeah, there's been a whole lot going on. A whole lot. And then like right now, I had like this freaking abscess underneath my arm and shit. And I do not want to go to the ER. I don't want to go to urgent care because I don't want them to cut it because I've had one under here before underneath my arm. And they cut into it and I had to pack it and all this. And I'm like, I'm not going through that shit right now because I already got enough going on here where I'm, having to drain and all that stuff. So I'm like, I don't want to deal with this shit too. And, so I've been trying to drain it myself and stuff, but it hurts. It's paining me and stuff like that. I think maybe I have ingrown hair and shit like that. But anyway, um, another reason why I don't want to go is because the shit is running so rapid. Even when I was at the ER last week, the nurse was telling another nurse, he's like, we got 6. Well, he was trying to talk to him, in code, but he was like, we got 6. And he was like, 6? He was like, yeah, we got 6. And I was just like, got 6 positive patients. Six patients that was positive for COVID. So I'm like, oh my God, I gotta get the fuck out of here because I don't have the shit. And I damn sure don't need to catch it. You know what I mean? I'm like, trying to get myself together right now without having some extra shit. I'm just now getting over a cold that I got from, my grandson and stuff, before I actually came home. And so that shit was rough. So I've just been constantly, coughing and a lot of mucus and stuff. And I was congested or whatever. And no, I did not have COVID because I had been tested, during that time. So I didn't have COVID. I definitely didn't have COVID. It was a little cold. But, it just seems like it's just one episode after another. Like, I just cannot get on the path of progressing without there being some type of stumbling block or somebody throwing a damn spike chain in the road. So last week it was that. This week is this damn abscess underneath my arm that's fucking paining me. And I'm just like, God, so it's just things like that that kind of gets me down, on top of the fact that this has been a slow process. And I know I've talked about it before that maybe I expect a faster progression. Maybe I'm expecting too much from myself, to heal faster and stuff. And I think it's because I think I probably think like that because, of the pressure of having to return back to work, you know. And because I think really, honestly, if I wasn't really worried about that I wouldn't expect myself to be like Superwoman right now. You know what I mean? So I just, you know, I was given a time frame to be able to return back to work, and I feel like, again, like if this situation hadn't happened, that I would be on schedule to actually return back to work without all these, these complications and stuff. I wouldn't be, fully 100%, but I would be at least 85, 90. You know what I mean? And still moving forward and getting stronger, but that's not the case. Um, I'm sorry, but look, so this is, without exposing too much. So I have to wear this thing in order to hold stuff together, and because the tubes moving around and stuff, it makes me so nervous having these tubes and shit. Like, as a matter of fact, when I went to the ER, they told me like I had to get undressed. You had to get undressed and put on the gown and shit. And oh my, so I'm undressing, right? And I get down to my pants. So I'm like, and I have a tube on this side. So the cord on this one is a little longer than the one on this side. So I go lift up my leg and the cord is like, it gets caught right underneath my knee. So when I pulled it, I yanked it a little, and I literally like freaked out. I was like, oh my God. So I think like I pulled the stitches a little bit because it was a little irritated. Like I yanked the stitches just a little bit. It not so much where they broke or anything, but I know I pulled it pretty damn good, so yeah, so that, oh my God, like I'm already paranoid as hell over these tubes and shit. So when that happened, I literally freaked out. I was like, oh my God, I was so bothered by it, that tug, that little tug, it just, oh my God. There, even when I think about it right now, still like it freaks me out a little bit. So I'm so paranoid with these damn tubes and shit. Like I'm so scared of, it getting yanked or pulled or whatever shit. And even like the one in my stomach. So like to help secure it a little bit, where it's just not just dangling, because I don't like it to dangle, because that kind of stresses me out a little bit. So I tape it up. To secure it, and that way it's not moving so much and twisting or whatever shit. Because like the nurses, when they come and do the bandages, they put the bandages that have the little slits, so it has a hole for the thing to stick out or whatever. They don't just completely cover it where it's connected inside. They don't completely cover it, so they have it actually sticking out of the bandages and shit. So it stresses me out quite a bit, worried about it getting tugged or pulled on or whatever shit, But yeah. So the COVID stuff is just absolutely insane. I knew this was gonna happen, and I think from my last posting, my last video, my New Year's video, I talked about people gathering, for New Year's and stuff like that, and this stuff just being out of control. So, after, New Year's, it's just like people just went crazy and shit, and now they're in ER and stuff, and they're sick and whatever, and they buying up tests, and they're doing the drive-through testing and shit like that because they're worried. But, well, I mean, God damn it. You know damn well nothing has changed. Nothing has fucking changed. So why would you go to a function regardless, like I said before, regardless if you're vaccinated or not, why would you go migrate in a huge group of people? And it doesn't even matter if you're distancing, for me, because that's just my paranoia. It doesn't matter. Just a room full of people in a kind of isolated area where there's no ventilation and shit like that. It stresses me out. And for me, I can tell when a place is contaminated because I don't know, it triggers me. I don't know if it's because I'm asthmatic, but I can tell where it's I'm in an environment where there's people that could be possibly positive, because I start getting like this irritation in my throat, almost like it feels like pepper or something being in my throat or something. I get a little irritation. So once I start feeling that and shit, I'm out. I'm gone. You ain't got no. I don't care what's going on in here. I'm gone. No, there's people in here that's positive. I'm out of here. I'm good. So yeah, I immediately get out of that situation. So just imagine, and most of the time that those situations happen, um, I wasn't in real close contact with nobody, but just that environment, the environment, and it's been in an area where I was outdoors and I got that feeling and shit, and I was just like, nope, it's time to go. There's too many fucking people here, you know? So, you know, um, I don't understand why people would do that. Even, of course you want to believe that your family members are being safe as well and stuff, and you think, okay, well, it's okay. This is my family. It's okay. If I hang out with them, and no, no, because you don't know who they're coming in contact with and what this shit is going now. The way this shit is going now, people are positive with no symptoms. So you may be talking to somebody and, you know, um, touching somebody, whatever shit, and you're not social distancing, and that person is positive. Now, they may not have the symptoms, but common sense. If that person don't have the symptoms and shit, what are they? They're the carrier, right? It's common sense. So now this person is giving it to other people whose immune system isn't as strong, you know? And we don't really know, or at least I'll say no, I'll say me. I don't know how soon, um, like once coming in contact with someone who is positive, um, you have a reaction to it, It could be within 24 hours. It could be, next couple of days. I mean, I don't know. But I'm sorry, my ear itches. It's my allergies. When my allergies get the acting retarded, my ears itch. My nose be runny and stuff. So I have allergy issues right along with the asthma, and yesterday was absolutely fucking horrible. Like, I was staying on my damn nebulizer. Literally, I was staying on my nebulizer. And I know I shouldn't be like taking it that much, because like when you do the nebulizer, when you do breathing treatments and stuff, kind of speeds up your heart rate and stuff. So but I was just coughing so much. Then I turn on the damn heater, and then I'm like, there's like this burning, or it almost smells like exhaust. And I'm like, what the hell is that? So, and so no heater today, no heater tonight. Forget that. I'd rather fucking get a bunch of blankets and get under a bunch of blankets, because I swear I literally slept with a mask on last night because the treatments wasn't helping. Uh, I have a humidifier. I'm sorry. I have a humidifier that wasn't helping. And so, yeah, so I went into another room, and um, it kind of eased up a little bit, but and I was okay for a few minutes, and then all of a sudden it started flaring up again. So I was just like, Jesus Christ. So I'm like, okay, let me just put on a mask, because at first I thought I was gonna have to and go in the garage and sleep in my car. So, but I didn't. Thank goodness I didn't have to do that, because the mask helped a whole lot. Well, I was able to get some sleep and stuff, but I didn't sleep restful. You know, I'm just gonna be honest. I didn't sleep restful. So I was tired today, a little sleepy today. Not to mention I took a pain pill, because after that walk this morning, my legs and stuff was hurting, my back was hurting a little bit. So yeah, I gotta try to push myself to at least do a little walk, every day, because you gotta think, like, I kind of been a little dormant for about a month now. It's been a month since I had my surgery, officially a month. So I haven't been doing a whole lot. So I gotta start getting my muscles back into a routine of being, doing stuff and walking and, stuff like that. But yeah, this vlog is a little boring, but I think I feel a little better coming in and actually doing the thing that I kept saying I was gonna do, but didn't actually do it because, the mood I was in and everything. So yeah. Um hmm, I don't know. I guess I don't really have anything else other than my appointment for next week. So maybe so my appointment is Thursday. So maybe I'll try to come in on Thursday and vlog about basically what the neurologist, or the post op, not the neurologist, I'm sorry, the post op um doctor had to say. Basically they should give me a date on when they're gonna take this side out, because the neurologist said it's like, oh, it's only going to be like a 5-minute procedure and stuff like that, and they're going to basically not give me anesthesia where it knocks me out, but just numb me up real good or whatever and take it out. So, and then the shitty thing about that, he was just like, we'll have to see how you do, once it's taken out and stuff. So he's like, you may do good, or it may be a situation where it's not gonna be good, and we'll have to put the tubing back in. So that kind of really fucking sucked. That he, that's something on the table. You know what I mean? Because I'm looking forward to the tubing being out. Okay, one less drainage, but if I don't do well and if stuff goes bad, then I gotta go back in and have them to put the tube back in my stomach and all of this, jazz. And I'm not looking forward to that. I'm really not. I'm hoping that once they take it out, I do great, and that, I just have to focus on the left side and trying to get well enough so I can get that one taken out before March. Because I'm not really comfortable going back to work, with any of these tubes, connected to me, because like I said, I'm very paranoid when it comes to these tubes and stuff. So I don't want to be at work and then something happens and it snags and gets yanked out or whatever shit, because I swear to God, I'm going to just fall over dead. I'm just going to fall over dead. Like, I don't want to have to worry about that. Seriously, I don't want to have to worry about that. But I guess we'll see. I guess we'll see what happens, with everything. Hopefully everything goes great with this, once they take it out, and we can continue to move forward with the healing process. But again, I guess we'll just have to see. I can't think of anything else that I can share right now. That was pretty much my past week and what's going on this week and future wise moving. So I'll be moving next month. So basically packing and stuff needs to start like ASAP. Um yeah. And so um I don't know. So I got to figure out my business stuff and see, cuz I think for the time being stuff I have to be in a storage and stuff shit. So I don't know. I don't know. I guess again we'll have to see how things go. But you know, I'm still doing my stuff and people I'm still shipping out orders and stuff like that, you know. Um yeah, that would probably be another video, maybe on my other channel. I do have another channel for my business. I think I have it in the description box below or whatever. You go check it out if you're interested. Not to stay here, my blog channel. So, I guess I'm gonna probably check out right now. So please like and subscribe and share. Comment below if you've had this experience, or if you know anyone who's had this experience. I like to meet other people that may possibly have had the same experience as myself. You know, I like to think that I'm not the only woman in the world that this has happened to. I really would like to think that. And then there's other people, and I like to maybe discuss like what did they do? How did they, you know, handle this process? You know, make it help me adjust a little better to this, you know. That's again, like I've been saying, this is the whole point of me coming in and doing these vlogs, is to maybe get the message out there and to reach other people who have had the same experience, or maybe, you know, maybe somebody else looking, you know, this will help somebody else, and you know, that's feeling a little shitty about their situation, I guess, you know. You get what I'm saying. But I really would like for this to reach other people who's had the same experience. That's the whole point of this, you know. Yeah, again, like I said, like, comment, subscribe. Subscribe. It's free. Okay. So I'm gonna check out of here. I'll be back probably next week, or if anything fantastic happens before then, I'll be back. Thanks for watching. Bye.